For anybody who just joined us, my name is Dr. Jeff Gelband. Today we are going to be talking about heart health. I am excited. Thank you everyone. I'm really looking forward to going over a lot of this with you. Before we get going on some of the things about heart health, I want to tell you a little bit about who we are at Aligned Modern Health, and then I'll tell you a little bit of who I am. At Aligned Modern Health, we have 4 teams that handle a variety of different issues that affect you. We are kind of a one-stop shop for all things alternative medicine and integrative medicine. The first team I'll talk about briefly is our chiropractic and physical medicine team. They do a great job working on musculoskeletal issues. So that's going to be pain, athletic performance, kind of just your aches and pains that are bothering you. As part of that team, we have our clinical massage therapy group. They work on muscle soreness, tightness, headaches. They do help with anxiety and stress, but they are a little bit different from a massage you might get at like a Massage Envy or another group, in that they are very clinical in how they operate. Usually, one of the physical medicine team will prescribe the treatments that they're going to provide to you. So they have a lot of benefit beyond just anxiety or stress relief. Our third team I'll talk about, acupuncture, kind of an Eastern medicine philosophy. They do an incredible job dealing with stress, anxiety, depression, fatigue, just amazing. One of the things I thought was so cool about what they do is they do great work with fertility. That to me was, I was very surprised to learn it. I thought it was amazing. And then the team that I'm on is the functional medicine and clinical nutrition team. The way I like to describe what we do is we treat a lot of the things that your primary care doctor would treat, but without the use of drugs and surgery. So we have a strong focus on nutritional management. We deal a lot with gastrointestinal issues, autoimmune disorders, and like what we're going to talk about today, cardiovascular issues. All right, give you a little bit of information about myself. So I already told you my name is Dr. Jeff Gelband. I'm a board certified chiropractic internist. I am the Associate Director of Functional Medicine at Aligned Modern Health. My specialties are nutrition, cardiovascular health, digestive health, and hormonal issues. I got my Doctor of Chiropractic degree at National University of Health Sciences, and actually it's not on here, but my postdoctoral degree, my board certification was from the American Board of Chiropractic Internists, my Bachelor of Science at Northern Illinois University, and I've served for 17 years as a Master Sergeant in the Illinois Air National Guard, where I teach CPR as a BLS CPR instructor, and I actually teach tactical combat casualty care as well. All right, so let's talk about heart health. This is what we're here for. You know, everybody kind of knows heart health is important, but some people may not realize how important it actually is. From Johns Hopkins Medicine, cardiovascular disease causes 2,200 deaths per day, averaging 1 every 40 seconds. That's a lot. I mean, that is a big deal. 78 million adults have high blood pressure, 20 million have diabetes, an additional 8 million have undiagnosed diabetes, and 87 million have pre-diabetes. We're going to talk a little bit more later on about why diabetes contributes to heart disease and the relevance of that. But that's a lot of people. A lot of people are dealing with these kinds of issues, and prevention is really key. You're going to hear that from me a couple of times today. Cardiovascular disease is the cause of more deaths than cancer, chronic lower respiratory diseases, and accidents combined. So, hey, again, it is a big deal. On average, someone suffers a stroke every 40 seconds of every day. All right. And then what is cardiovascular disease? We're going to talk about a couple of basic terms. You might have heard some of these, but you didn't know exactly what they were. Arrhythmia just means an abnormal heart rhythm. There are several different kinds. One of the more common kinds you may have heard about is something called atrial fibrillation, or AFib. It just means one particular part of the heart isn't beating correctly. It's got an abnormal rhythm. Atherosclerosis is the plaque buildup in the walls of the arteries. It's a contributor for heart attack and stroke, and in some cases it can be the cause. A heart attack is when blood flow to one part of the heart is blocked by a blood clot. If the clot cuts off the blood flow completely, the part of the heart muscle supplied by that artery begins to die. Like any part of your body, if it's not getting blood flow and therefore oxygen, it's going to not be able to function, and that tissue will begin to die. Heart failure is different from heart attack, in where heart attack, there's damage being done to the heart from a lack of blood flow. Heart failure is the heart's inability to effectively pump its blood. So you may have heard congestive heart failure. And basically, when that happens, blood generally isn't moving through the entire body the way that it should be. Heart valve problems. The heart valves, what should happen is when the heart beats, the valve opens, and then when it's done with its beat, the valve closes and doesn't let blood go backwards. If the heart valves don't open enough, that's called stenosis, and blood can't get through the way it should. If they are opening but they're not closing completely, that's called regurgitation, and it lets blood go backwards. Both can be serious problems. And then the last term you may have heard is like a stroke. I think a lot of people are kind of aware that a stroke is a problem with the brain, but it's actually a cardiovascular problem in that it occurs when a blood vessel that's feeding the brain gets blocked, usually from a blood clot. And again, just like with a heart attack, when some tissue is not getting oxygen, it's going to die. So if a part of the brain doesn't get oxygen, we get symptoms based on the part of the brain not getting oxygen. All right, kind of behind the scenes here. So when we talk about that atherosclerotic change, that plaque buildup that we get, most of that comes from damage to the blood vessels. You're going to see a term on here, endothelial damage. When we see that, what we're really talking about is damage to the inner lining of the blood vessel. So when that damage occurs, it results in the formation of a blood clot. The resulting blood clot is minimized, and a new endothelial layer grows on top of the remnants of the blood clot, thereby incorporating it into the artery wall. And, this sounds very complex, but what it's really saying is it's kind of like if you got a cut on your skin. If you get a cut on your skin, your body forms a clot. We call it a scab, right? It's healing. And then in this case, new tissue, new blood vessel tissue will grow over top of that little scab. And when it says it minimizes it, it means that it tries to make it, occlude the blood vessel as little as possible to kind of smooth it out. So this process leads to inflammation, but it's not a bad thing. It's actually healthy. This is something that we want to happen. Now, we don't want this to happen a lot, but it does happen just from us being alive. That's not a bad thing. The problem occurs when the rate of damage exceeds the body's ability to repair itself. That's what leads to cardiovascular disease. And insulin resistance, type 2 diabetes, chronic inflammation, those things reduce your body's ability to heal itself quickly and effectively. So imagine I used the analogy of if you got a cut on your skin. So imagine you got a cut on your skin, the scab forms. Then before that scab goes away, you get another cut over top of it, and you're getting scabs kind of forming on top of one another. Well, that is kind of what's happening here. And I'm oversimplifying it a little bit, but the point being that eventually this is a closed area. So when those things kind of build up, that can be a real problem. All right, how do we evaluate your risk? We have a lot of tools at our disposal to do a full evaluation of what your cardiovascular risk is. I have just a few of them on the screen. Some of these you may have heard of, some of them you may not have. The first one, cholesterol ratios. So LDL and HDL. Most people have probably heard of these. Those are two different kinds of cholesterol. LDL is we call it the bad cholesterol. HDL is the good cholesterol. LDL gets a little bit of an unfair rap. So it's not bad. It's when it's elevated, what it represents is bad. And I'll tell you just a very brief explanation of that. And then lipoprotein subfractions, that sounds very complicated, but it basically has to do with how big or small some of those are and some special characteristics of them. It can give us some information about kind of like how sticky that bad cholesterol is. Again, it's a little more complex than that, but that's an easy way to think about it. So just to give you a very brief explanation of what LDL is, what HDL is. LDL, is we call it the bad cholesterol. It's responsible for helping with repair of the blood vessels. So when we get that damage and we get that little scab that's forming, LDL goes out and helps us put a Band-Aid, like a little Band-Aid, it's literally like a little fat Band-Aid, over top of that scab to protect it from the bloodstream, because your blood never stops pumping. And so after it's done healing, the HDL, which we call the good cholesterol, goes out there and cleans it up. It says, hey, we don't need this Band-Aid here anymore. I'm going to get rid of this for you. So that's a good thing. So if we have too much LDL, we say it's bad because that means we have a lot of vessel damage and a lot of those little band-aids are getting put in place. If we don't have enough HDL, we don't have enough people cleaning up the Band-Aids, and that causes a different problem because now those Band-Aids can calcify, and once they calcify, you can't get rid of them. They stay there. So all of these different things kind of play a role. So hopefully now when you do see your markers, your LDL, your HDL, you'll have a better understanding of what that actually means. Insulin, really important. So we talk about insulin in relation to diabetes. I'm not going to go too much into it, but to give you a brief explanation of its issue with cardiovascular disease, it's very inflammatory. So it causes a lot of blood vessel inflammation. Blood sugar. The reason this is important, the reason diabetics have issues with cardiovascular illness is because the more sugar you have inside of your blood, it creates a coating on the outer wall of the vessel. And with that, the more sugar, the thicker that coating becomes over time. This is the reason why diabetics will sometimes lose a foot or a toe or those kinds of things, because eventually in some of the places where it's more difficult to get blood flow, if you start to narrow those very, very small vessels, capillaries are only one cell wide. So if you start to add a coating on there from sugar, and that's permanent, by the way, it never goes away, then sometimes the blood can no longer go through there. And just like I mentioned, when blood can't get somewhere, the tissue dies. So blood sugar is a big contributor there. High sensitivity C-reactive protein is an inflammatory marker that can tell us about the inflammation in your heart and blood vessels. Homocysteine is a marker of how well your B vitamins are doing their jobs, but also for multiple different reasons, it gives us an indication of your overall cardiovascular health. B vitamins, one of their primary jobs is to detoxify different things from your body. So when we see homocysteine elevating, not only does it cause cardiovascular issues itself, but it also tells us that your B vitamins aren't effectively detoxifying other things from your body. Iron is important if you have too much or too little, which doesn't seem fair. With iron, if you have too little of it, then your body has a reduced ability to carry oxygen to the tissue. So if you already have an existing heart issue, that's a big problem. If you have too much of it, it's very toxic stuff. That's the reason every iron container or anything with iron on it always has a child-proof safety lid. And so too much iron is a big problem too. It does damage to a lot of different systems of the body, including the heart. And then finally, omega-3s. Everybody's probably heard this. Omega-3s are pretty well known at this point, like fish oil or flaxseed. But again, those are very excellent to help prevent cardiovascular illness. And we can check what the level of those things is in your blood. I'm sorry, I'm speaking quick. It's really exciting to me. So now we'll talk about some other things that you guys can do at home. Okay. So really briefly, this was a piece of research I found really fascinating. I wanted to put it in here. It's from 2015, and it's from Circulation Research, which was an American Heart Association journal. And they found some really cool stuff. So the study had 893 participants. They found that the absence of 6 specific species of bacteria predicted a higher BMI. BMI is a measure of your body mass index, so basically overweight or obesity. So when these 6 bacteria weren't present, you're more likely to be overweight or obese. The gut bacteria present altered HDL, the good cholesterol, triglycerides, which are the free-floating fats in the blood, and BMI. The results were consistent even when taking into account the effects of age, sex, and genetics. So just by themselves, they were able to isolate that the effects were from those bacteria. So finally, I'll read this, but then I'll kind of explain just what that means. Our study suggests that the gut microbiome may play an important role in the variation in body mass index and blood lipid levels, independent of age, sex, and host genetics. Our findings support the potential of therapies altering the gut microbiome to control body mass index, triglycerides, and high-density lipoproteins. So what does that mean? It means that this is another reason why we take a look at the whole body. Your elevated triglycerides or your low HDL could be caused by a digestive issue you're having, which is causing a dysbiosis or an improper balance of growth with your gut bacteria. So it really is all connected. Some people are on statins to help reduce cholesterol. So I want to very briefly talk about them. I'll tell you what they are, why they're okay, but not great. Some people need them though. It's estimated that 1 in 5 Americans have been prescribed a statin. So a lot of people are on these. It's one of the most common drugs to be prescribed. They've done some research about a Mediterranean diet versus a statin prescription, and Mediterranean diet is much more effective in reducing the risk of cardiovascular disease without necessarily lowering cholesterol, because some cholesterol is good. We often talk about cholesterol in the context of heart disease, which is something very important that it's associated with, but it actually has a lot of functions outside of that, including helping you fight infection and repairing damage from infection. It's involved in hormones and more. There's a lot of things. So we don't want it to be too low. That can cause a different set of problems. In a series of clinical trials, statins only increased lifespan by 5 to 27 days versus healthy habits. And there are people that do need to be on them, though. So there are people born with a genetic defect called familial hypercholesterolemia. That's basically a genetic issue where the elevated cholesterol that those individuals are experiencing is not a result of vessel damage. They just make too much as it is as a result of a genetic error. So those individuals do need to be on statins. That is one place where that is always the first line approach, and it should be. Whereas with Mediterranean diet and a lot of other dietary changes, we can actually do a lot more for a lot of different issues. Some of the side effects of statins: it reduces CoQ10. A lot of you may have heard of it. It's very good for heart health. It actually helps the heart create the energy it uses to continue pumping. So we don't like that very much. It inhibits the synthesis of vitamin K2, which is very important for calcium in the blood, which does a lot more than just bone health. And it reduces ketone production. Some of the risks of statins: there are a couple here. So cancer, because everything causes cancer, diabetes, cataracts, neurodegenerative issues, liver disease, musculoskeletal and nerve disorders, and heart failure. And we just talked about CoQ10, right? So yeah, doesn't that seem, it's a little strange, but it's okay. Again, some people do need them. All right, we'll talk about aspirin. So this is another study I wanted to bring in here, very interesting. So there's a long-standing belief that if you should just take aspirin. If you think you're at high risk, just take an aspirin every day. That's really not the case. And so this was a great study. This was done just a few years ago, 2018, 19,000 participants, over 19,000 in a 14-year study. Aspirin increased the risk of death by cancer. Aspirin did not reduce the risk of death by heart disease. And I want to be very clear about this. So what this study was on healthy elderly that do not have any heart disease. So I'm not saying aspirin has no useful function in heart disease. I'm saying in the absence, well, we'll go a little more into it, but in the absence of a person who has had a heart attack or who has some very specific risk factors for heart disease, unless you've been prescribed it by your doctor, you should not be taking aspirin, baby aspirin daily. All right. You don't have to take my word for it, though. The FDA and the American Heart Association feel the same way. Both of them do not recommend aspirin for the prevention of heart attacks in people who have never had a heart attack, stroke, or other cardiovascular condition. The research we have shows that aspirin can help prevent the second heart attack, but there is no good evidence that it helps prevent the first. So like I said, you should only take it if you've been prescribed it. If you've been prescribed it by your doctor, they've weighed the risks and they've decided that in your case, it's more appropriate that you take it. So just briefly, I want to read what the FDA said about it. After carefully examining scientific data from major studies, FDA has concluded that the data do not support the use of aspirin as a preventative medication by people who have not had a heart attack, stroke, or cardiovascular problems, a use that is called primary prevention. In such people, the benefit has not been established, but risks such as dangerous bleeding into the brain or stomach are still present. Aspirin can cause bleeding. The American Heart Association. Because of the risk of bleeding, aspirin therapy is not recommended if you have never had a heart attack or stroke, except for certain carefully selected patients. If you're over 70, taking aspirin to prevent a first heart attack or stroke could do more harm than good. So this isn't just coming from me. You may not have heard that, but for a lot of reasons, it was a very popular thing to do about 20 years ago. To everybody should be on a baby aspirin if you're over 50. But we've seen a lot of research since then showing that that's really not the case. So all that said, what can you do? Well, here are some healthy habits to avoid heart disease. Through their doctors, most people go after a lot of the symptoms rather than preemptively reducing the risks and causes. I mentioned you earlier. Prevention is the key. Prescription pharmaceuticals, it's like mopping the floor while the sink continues to overflow. So not great. So here's what we can do at home. Enjoy a low carb, processed food diet, low carb, low processed food diet, and increase nutrient absorption. Optimize your vitamin D and magnesium levels. We can check those and let you know. Normalize omega-3s versus omega-6s. It's valuable to check what levels those are at, but we'll talk more about this. But some of the things for omega-3s are just eat more fish. If you are okay eating fish, just increasing the amount of fish you eat can be helpful. Some fish are better than others. Salmon is excellent. Implement a healthy sleep routine. We're going to talk more about that. And exercise regularly and reduce stress. Those are huge. So let's go into it. Diet and nutrition. I talked about vitamins D and magnesium, vitamin C, K2 also very important. So all of these things, really making sure that we're getting a very balanced set of nutrients in our diet is incredibly important. Lots of organic vegetables. You may have heard the phrase before, eat the rainbow. Deeply colored vegetables like especially your purples, oranges, reds have a phenomenal different spread of antioxidants and nutrients within them that help prevent, among other things, heart disease, cancer, and just a slew of other issues. Having healthy fats to regulate blood glucose levels, blood lipids. Making sure we're eating like virgin coconut oil. MCT oil is great, and it's become very popular lately, and extra virgin olive oil. Eating nuts and seeds, avocado, those things are phenomenal. All right. And then when you do cook, the one thing I do recommend, don't cook with extra virgin olive oil. I recommend cooking with things like avocado oil, coconut oil, or ghee. Those are really good oils to cook with. And then hydrating. So make sure that you are drinking enough water. Your blood will literally become thicker if you don't drink enough water. So at least half your body weight in ounces daily is what we recommend. What you might not realize how much that actually is. When you start to drink more water, you realize it's actually a lot that you need to drink. So I don't recommend going from 0 to 100 on that, so to speak, but slowly incorporate water. If you can add maybe a glass per day each week until you get to where you're at, or until you get to where you should be, that's a great way to do that. You can also do things like tea, decaf tea, so herbal tea, but caffeinated tea, coffee, and carbonated beverages aren't exactly the same as just water. So be sure that you are drinking those things, or less of those things, Optimize vitamin D and magnesium. So we talked about this. Vitamin D over the last many years has received a lot of attention, not just for its role in cardiovascular disease and type 2 diabetes, which is kind of the focus of what we're talking about here, but really for a lot of things. We found that it helps to reduce systemic inflammation, inhibit vascular smooth muscle proliferation, and vascular calcification. I mentioned how those kind of fat band-aids that protect the vessels can calcify over time. Well, it happens faster when your vitamin D levels aren't at an appropriate level. It regulates blood pressure and volume homeostasis, meaning the quantity of blood. It regulates glucose metabolism. So we want to aim for levels between 60 and 80 in your blood. The best way, getting regular sensible sun exposure. And because we're in the Midwest in Chicago, and especially during this time of year, a vitamin D3 supplement, not a bad idea for most people. Magnesium helps the heart and blood vessels to relax. It helps the heart's electrical system operate properly, keeps the circulatory system pumping blood, helps it pump blood, and it's important for the digestive tract, the lungs, a huge number of things. So super important. Almonds, cashews, avocados, black beans are some of the best sources. For people who aren't sensitive to estrogen issues, edamame and soy milk are fine. Spinach and yogurt are fantastic. So a lot of great things. Emphasizing those is a wonderful way to increase your cardiovascular health. Excuse me. Omega-3 fats are essential fats that you need. We talked a little bit about it, and I'm going to go through this a little bit quickly because it's just a lot. Omega-3s are antiarrhythmic. They counteract and prevent cardiac arrhythmia, antithrombotic. They are wonderful. Okay, they do a lot of things. They improve endothelial function, so the actual function of the blood vessels themselves. Best sources are fatty fish, salmon, sardines, and anchovies, fish oil pills, or krill oil. Plant-based sources are good, but not as good as those other ones. Implement a healthy sleep routine. So this is so super important. We want to aim for about 8 hours of restorative sleep per night. If you don't get enough sleep, fundamentally, your body does not repair itself properly, and that includes the heart and blood vessels. We don't always think about those, but they are always in a state of repair, and they need it. So we need our sleep. These are some good tips to improve your sleep: proper sleep hygiene, turn off electronics and bright lights at least 30 minutes before bed, especially blue colored lights. Keep your bedroom dark and cool. About 2 degrees cooler than you keep the rest of the house is what's generally recommended. Turn off your Wi-Fi and put work away. Develop a bedtime routine. So do the same thing at the same time each night. Avoid fluids and urinate prior to getting into bed. Avoid caffeine late in the day. And utilize breathing exercises like deep breathing or box breathing to help. This can be so incredibly helpful to get to sleep and get a more restful night's sleep. Exercise regularly. So regular exercise reduces the risk of metabolic syndrome, which is characterized by a large waist circumference, high triglycerides, a low HDL, high blood pressure, and high blood sugar. It helps to release nitric oxide, which helps your blood vessels get a little bit bigger. They dilate. It lowers blood pressure and reduces inflammation. So aim for 10,000 steps daily. It's your goal. This doesn't have to be that you're going to the gym and pumping iron. We have strength training. We have a little picture of a person lifting weights like that, but it could be a machine and it can be light weights. But we've actually found that strength training, we used to focus only on cardio. We found that strength training helps improve your blood sugar response and can help prevent or reverse, in some cases, diabetes, type 2 diabetes, And so that has its own effects on improving heart health. So getting your steps, doing strength training, and then stretching and yoga. Outside of helping with blood pressure, it's such an incredible stress reliever. My personal favorite part for anyone who does yoga is Shavasana. But any of those are just wonderful ways and so incredibly important to be getting on a regular basis. If nothing else, get your 10,000 steps in. Reducing stress. Yoga and exercise are great ways to do this, but stress is a normal physiological response to events that make you feel threatened or upset your balance in some way. The term stress is short for distress. There's another one called eustress, which is good stress, but we want to make sure that we're managing our distress. When you sense danger, whether it's real or imagined, the body's defenses kick in and your sympathetic nervous system really kicks in. That's that fight or flight response. That's okay if there's a known problem, but if your body's doing that all the time, it can cause cardiovascular issues. You're going to get, we talk about this your adrenal glands secrete cortisol, really important hormone. But when it's constant, like I was just saying, that's when the issue comes in. Your body never has a chance to relax and return to normal function. Some ways to reduce stress are deep breathing, helps with sleep too, like we just said. Meditation and mindfulness practice. Even if you can get in 10 minutes a day, even 5 minutes a day, that will be helpful. There are some great apps that do that for free that'll walk you through that. Limiting or eliminating alcohol and caffeine intake, especially caffeine intake. Exercise, incorporating yoga, like I said, keeping a journal, just writing down your thoughts and feelings, how you're doing in a day. And then finally, acupuncture is incredible for reducing stress. Really, really wonderful stuff. In summary, cardiovascular disease is prevalent. We've talked about it. It's so common. And we are quick to jump to pharmaceuticals to address the symptoms. However, through diet, nutrition, healthy sleep, regular exercise, and steps to reduce stress, we can regain control of our own health and potentially stop heart disease before it starts. So again, I've said this a few times, preventing it is the key. Even when there's something there, we have a lot of great options, but even more options to help prevent it. Thank you so much for joining us today. I hope that you all enjoyed it. I hope that you learned something. Please enter any additional questions in the Q&A feature now, or if you have any very specific questions about your case, you can schedule a personalized free 15-minute consultation by calling 312-216-2452 or visiting us at alignedmodernhealth.com. You'll also see some of the different insurance providers that we're in network with listed next to the services that they correlate to. Okay, so give me just a moment to open up the Q&A and let's talk. Okay, excuse me just a moment. All right, so starting out, somebody asked, which type of magnesium do you recommend? It varies. We use different types of magnesium for different things. For heart health, magnesium glycinate is one of the better ones, but it honestly depends. There are a few different uses for it, or for different forms of magnesium. How do you feel about calcium supplements? Calcium supplements are fine. We used to have this belief for bone health to superdose calcium like 10 grams a day. We found that doing that actually increased heart disease. So now we generally recommend 2 to 3 grams per day for the prevention of cardiovascular issues. But a lot of people get enough calcium from their diet. So again, I recommend checking with your doctor in your specific situation. Someone asked, you mentioned salmon is very good. Is there a difference farm-raised salmon versus wild-caught in terms of its health benefits? Yes, there is. Wild-caught is better. The reason that wild-caught salmon is higher in omega-3s is omega-3s are caused by the fish living at a deep sea environment where it's very cold. So the fish develops those. That's part of how it stays alive. That's why deep sea fish tend to be healthier. Ones that are farm raised tend to be raised in warmer water, and so they don't develop as many omega-3s. There are some other issues where they're fed a lot of antibiotics and other things that make them slightly less healthy. I would rather you eat farm raised. If, for example, if wild caught's too expensive, farm raised is better than not having any fish at all. So I definitely recommend that. Will we be sharing this? I'm sorry. Thank you for asking that. Everybody here will receive a copy of this presentation and the recording of this as well. Someone asked, when considering taking supplements such as C, D, K2, and magnesium, is it easy enough to just follow the manufacturer's recommended doses, or is balancing these nutrients nuanced enough that we really ought to be using an appropriate professional to help us determine these doses? So there are some things like vitamin C and magnesium that generally you can follow the dosage recommendations for. They're water soluble, so for the most part, if you take too much, you'll urinate out the rest. However, with vitamins D and K2, I do definitely recommend seeing somebody to check your levels. It's very easy to take too much or too little. Usually after a short period of time of supplementation, we can determine an appropriate long-term dose for you. So yeah, for the most part, I recommend seeing someone, but vitamin C and magnesium are generally safe to take per the bottle's recommendations. Can you please repeat what oils are good to cook with? Also, how can you tell if olive oil or any oil has gone rancid? That's a couple great questions. The first is the oils to cook with. Some of the best ones are going to be avocado oil, ghee, which is clarified butter, grapeseed oil, which I didn't mention before, and coconut oil, if you're okay with all your food tasting like coconut. So no, the other ones don't have much of a flavor. Coconut oil does. Those are some of the best high heat oils. If you're going to bake something at 300, 325, use any oil you want. But if you're cooking in a frying pan, that's what those are for. In terms of telling if olive oil or another oil has gone bad, it'll usually taste rancid. It doesn't always. But also based on the date. That's really the best way. Whatever the date is, most of them will have a date on it. Oils, I do not recommend using past their date of expiry or their best by date. Is there any reason a person's heartbeat goes very slow while sleeping? Yes, it is because you don't need as much blood flow while you're sleeping. So that's typical. Now, for some people, it goes too slow, and sometimes that can be a sign of sleep apnea or other issues. So it depends on how slow is very slow. It shouldn't be dropping below, for example, 60, with the exception of certain specific individuals. That's generally the lowest it should be. What is an option other than fish oil for omega fats? So other than fish oil, some good vegetarian options are going to be like algae is a good option. You can use flaxseed, which is a great source of another kind called alpha-linoleic acid. However, the problem with that is that kind of omega-3 is not used as well as the other two, EPA and DHA. But there are some omega-3 oils on the market made from algae, so that's another option. All right, regarding the stress slide, I've been diagnosed with hypertension. Does this mean that a stressful day or specific event would directly influence my blood pressure, or is stress cumulative over time? So yeah, a particular stressful event will influence your blood pressure. Absolutely, that's well known. But we're not worried about elevated blood pressure that elevates periodically. The problem comes in when your blood pressure stays elevated. That's actually the reason that when we diagnose blood pressure, the first time blood pressure is checked is not when it's diagnosed. It has to be done at 3 consecutive times, preferably at different times of day. So sustained elevated blood pressure is the problem, not just that. And in terms of stress being cumulative over time, kind of, not necessarily. It depends. So it's kind of like anything. If we pour water in a glass, that'd be like your stress. If you keep pouring water in the glass and you never get rid of any, that'll accumulate. So your stress response can accumulate, but doing things like stress management, like we talked about, yoga, meditation, getting a restful night's sleep, those things help to reduce the water in the glass, so to speak. Is having hypoglycemia a sign of an onset of diabetes type 2? It can be, but it is not necessarily. Excuse me. It depends on how that hypoglycemia is coming about, but generally speaking, reactive hypoglycemia, which is what I think you're talking about, is not necessarily like that. Okay, bear with me. Okay. And then do lower dose statins reduce the risk of bad side effects? For some people they do. It just depends. However, if your doctor has prescribed you a statin, take it at the dose you are currently taking. Do not change your dose of statin on your own without consulting whoever prescribed it to you first. After taking vitamin D3, should we be taking K2 to better absorb the vitamin D? That is a very smart question. I prefer vitamin D3 and K2 supplements that contain both together rather than a K2 on its own, because then you're getting the appropriate ratio of D3 to K2. All right, what are the 6 probiotics that are good to lose weight? I'm not going to go into that. It's a little bit more specific than that. They're well known, and the study is actually listed there, so I encourage you to look at it. It says it in the study, but yeah, a little more than I want to go into for this. Is berberine a good supplement for insulin resistance? That can be very good. Again, it depends. I don't want to say you should take berberine. It can help improve your insulin response, but everyone's a little different. That is something that we use sometimes for that purpose, though. All right, bear with me just a moment. And for persons who are very physically active to the point where we're sweating a lot, how would you recommend managing sodium intake with respect to heart health? Are there any adjustments that you would make? Yeah, so if you're sweating a lot, it's a good idea to use some kind of electrolyte rehydration or electrolyte replenishment. That might be something like a Noon tablet. There are a handful of other companies that make great products. I don't have a particular one I recommend, but if you're sweating a whole lot, doing very strenuous exercise, that is a very good way to go. Okay. With that said, that is all the time that we have for today. We have a lot of great questions here. We have had a lot of great questions. For those of you that I didn't get to, I do encourage you to reach out for a free 15-minute consultation if you still have questions. Thank you guys so much for coming here. It really was, it was great speaking with you.